So there are many markers of health that I think are underappreciated and undertested in primary care in Alberta and in Canada in general. So two of them that I'll highlight here. Actually, one is related to a cardiovascular disease risk marker called lipoprotein little a, or LPA for short. And this is a marker that is fairly genetic, meaning that roughly 70 to 90% of the variation in this lab mark can be due to your genes or your family heritage. Now, that's still important to test, and maybe you only need to test this marker once in your life, but it can predict disease 10, 15, 20, 30 years down the road. And it is underappreciated, undertested, and in my opinion, it's an integral piece of the pie that a doctor must know when they're talking about your overall risk profile and whether or not you need to be aggressive in changing the way that you live, your diet, your lifestyle, your physical activity, or medications to reduce your risk of cardiovascular disease. So LP little a is one of those. Another one that I think is underappreciated, and it's somewhat because it's difficult to test in a standardized way, and this is cortisol. So you've probably heard of cortisol. It's deemed as a stress hormone. It's potentially demonized as a bad thing because it can lead to potentially some belly fat gain or difficulty losing weight around the belly. It can also throw off your blood sugars. It can throw off your immune system a little bit. But cortisol is a really important hormone. Your body produces it for a reason. And it's really important first thing in the morning. It's a hormone that helps you get out of bed. It gives you energy and mobilizes you so that you are ready to tackle the tasks of the day. So cortisol really needs to be in your body at a certain time of day. And that's first hour of the day, maybe the first 2 hours of the day. And then we want it to come back down and we want it to stay nice and low for the rest of the day. And we especially want it to be low right before you go to bed. If cortisol is not low right before you go to bed, it typically will suppress a sleep hormone called melatonin. You may have heard that. You may take a supplement called melatonin over the counter to help you sleep. And what you might not know is the relationship between cortisol and melatonin is well studied. They go in opposite or inverse directions. So we love to test cortisol, and we have to do it by testing throughout the day. So we can't just look at a single snapshot in your bloodstream first thing in the morning. We actually have to look at cortisol throughout the day using either saliva or urine or a combination of the both. So that's two health markers that I think are underappreciated, undertested, and not used enough in clinical practice.